Welcome to RN Mujib, the channel that brings you expert, simplified health education to empower your wellness journey. If you're passionate about understanding medical conditions and protecting your health, subscribe now and tap the notification bell so you never miss a video. Today's topic is one of the most common blood disorders worldwide, anemia. Anemia is a condition where your body doesn't have enough healthy red blood cells or hemoglobin, which is the part of red cells that carries oxygen to your tissues. When your body lacks oxygen, you feel weak, tired, and out of breath. Anemia occurs when your body 1. Loses too much blood from injury, surgery, heavy periods, or internal bleeding. 2. Doesn't produce enough red blood cells due to poor nutrition, bone marrow problems, or chronic disease. 3. Destroys red blood cells too quickly, as in some autoimmune or inherited diseases. There are many types of anemia, each with its own cause and treatment. Let's look at the most common ones. 1. Iron deficiency anemia. The most common type, caused by not having enough iron in the body to make hemoglobin. It can result from poor diet, blood loss, or increased needs during pregnancy. 2. Vitamin deficiency anemia. Includes B12 deficiency and folate deficiency anemia. These vitamins are essential for red blood cell production. A lack of them causes red blood cells to be large, irregular, and ineffective. 3. Aplastic anemia. A rare but serious condition where the bone marrow fails to produce enough red blood cells. It may be caused by infections, toxins, or autoimmune diseases. 4. Hemolytic anemia. This type happens when red blood cells are destroyed faster than they can be made. It may be inherited or caused by autoimmune reactions, infections, or certain drugs. 5. Sickle cell anemia. A genetic blood disorder where red blood cells become crescent-shaped, sticky, and fragile, blocking blood flow and causing severe pain, infections, and organ damage. 6. Thalassemia. Another inherited blood disorder, mostly affecting people from the Mediterranean, Asia, and Africa. It causes the body to make abnormal hemoglobin, leading to the destruction of red blood cells. Each type of anemia needs specific evaluation and treatment. You're more likely to develop anemia if you have a poor diet low in iron, B12, or folate. Experience heavy menstrual periods. Are pregnant. Have chronic diseases like kidney disease, cancer, or autoimmune conditions. Have a family history of inherited anemia. Take NSAIDs frequently. Suffer from intestinal disorders that affect absorption. Anemia symptoms can develop slowly and include fatigue and low energy, shortness of breath, pale skin and gums, fast or irregular heartbeat, dizziness or headaches, cold hands and feet, brittle nails and hair loss. In severe cases, chest pain, confusion, or fainting. In children, it can affect growth and learning ability. To diagnose anemia, doctors usually start with a complete blood count to check hemoglobin, hematocrit, and red cell count. Peripheral blood smear to see the shape and size of red blood cells. Iron levels, vitamin B12, and folate tests. Bone marrow biopsy or genetic tests if needed. The tests help determine the type and cause of anemia for proper treatment. Treatment depends on the type of anemia. Iron deficiency anemia, treated with iron supplements, dietary changes, and treating bleeding sources. Vitamin B12 folate deficiency, treated with vitamin injections or tablets. Aplastic anemia may require blood transfusions, bone marrow transplant, or immunosuppressive therapy. Hemolytic anemia, treated with steroids, medications, or managing the immune system. Sickle cell anemia, managed with pain medications, blood transfusions, and sometimes bone marrow transplant. Thalassemia may require regular transfusions, iron chelation therapy, or gene therapy in the future. You can prevent some forms of anemia by eating foods rich in iron, like red meat, spinach, beans, lentils, and iron-fortified cereals. Consuming vitamin C to boost iron absorption.